T-safe. IUD preparation and insertion. Preparation. Arrange all equipment for the procedure in order of requirement on a sterile surface. Reassure the woman and tell her what is happening at each stage of the procedure. Ask the woman to relax her pelvis as much as possible. Use leg supports or a wedge cushion to tilt her pelvis to the appropriate angle. Perform a vaginal examination to determine the position and size of the uterus. Then insert a speculum while asking the woman to exhale deeply while relaxing the muscles of her pelvic floor. Ensure that there is a clear view of the portio, and if necessary, cleanse this with an antiseptic gauze. Stabilize the uterus by grasping the anterior lip of the cervix with a tenaculum forceps. Ask the woman to cough at this moment to minimize discomfort from the forceps. If the uterus is in a retroflexed position, it is advisable to grasp the posterior lip of the cervix. Stretch out the cervical canal with the forceps, applying light traction. Probe the cervical canal and the uterus to determine the length and position of the uterus before opening the IUD packaging. If the probing is unsuccessful or presents any difficulties, it is advisable to refer the woman to a gynecologist. Insertion. The IUD is supplied with a convenient insertion system so that it can be inserted into the uterus in a simple and convenient manner. Step 1. Prepare for use. Open the sterile IUD package. Hold the nylon threads in your hand so that they do not slip inside the insertion tube. Using the white plunger, press the IUD carefully upwards until the IUD protrudes 2 mm out of the insertion tube. Set the blue ring according to the measured uterus length. Check that the broadest side of the ring is parallel to the direction in which the arms of the IUD will unfold in the uterus. The IUD is now ready for insertion. Step 2. Insertion. Maintain light traction on the uterus with the forceps. Insert the insertion tube with the white plunger carefully into the uterus up to the fundus. The blue ring now touches the portio. Let the forceps rest on the speculum. Hold the broad part of the white plunger with thumb and index finger and slide the insertion tube backwards. The horizontal arms of the IUD will unfold. The IUD is now released into the uterus. Step 3. Completing the procedure. First, remove the white plunger and then the insertion tube with a light twisting movement. Trim the nylon threads to about 3 cm from the portio. Finally, remove the forceps and the speculum and provide the woman with a sanitary towel. From the moment the T-safe is inserted, the woman is protected from pregnancy for a period of 10 years. Removal. Replacement of the IUD. The IUD can be easily removed by pulling on the nylon threads with forceps. A new IUD can immediately be inserted if required.